Lecture 2, where we look at standard anatomical position. Of course, what we should ask ourselves is, what's a standard anatomical position? Now, when you look at this image here, this is the image of a human body, standing in standard anatomical position. So, when you look at the body stands upright, that's erect, of course. The head and the eyes face forward, the feet are flat on the floor, as you can see here. They're close together, of course, and pointing forward. So the arms separate at the sides, and then the palm of the hand face forward. And when you talk of forward, you talk of anteriorly. And then the thumb points away from the body. So they're lateral, of course. So that's what we refer to as the standard anatomical position. Okay, so all these points define anatomical position. So let's look at the next slide. We look at the terms that indicate directions, where we look at the superior, inferior, cranial, caudal, etc. So now when you look at the superior, which at times referred to as cranial, means towards the head, to hide your head, end, or upper part of the body. So, like for example, the head is normally superior to the chest. Of course, the head is at the top of the chest. Therefore, the head is superior to the chest, and the chest is inferior to the head. And then we have inferior or caudal, which means away from the head and or towards the lower part of the body. So, an example is the stomach. Of course, the stomach is inferior to the heart. You see, the stomach is always located on the lower part, therefore it is inferior to the heart. Okay? And then cranial. Cranial means toward the skull or head end of the body. So this term is normally used interchangeably with superior in humans. Of course, it may also mean a superior. Then we have caudal. Caudal means towards the lower part of the body. So in humans, it corresponds to inferior in humans, of course, inferior in humans, also known as inferior or caudal. Like you can see this image here, when we are moving toward the right, it means you are moving laterally, or either toward the left, you are moving laterally. But as much as you are moving toward the middle line, we talk of medial. You are moving medial. And then we have distal, which means far away from the attachment. Okay, it's gonna be the elbow being distal, or we can talk of distal in terms of the knee. Okay, so we have also anterior and the posterior. So when you talk of anterior, talk about the ventral or the frontal part. We talk of posterior, talk of the dorsal, the back part. It's referred to as posterior. Okay. In the summary of these terms, we can say that superior means toward the head or the upper part of the body, and the opposite to superior is inferior. So the nose is superior to the mouth. Of course, the nose is found on top of the mouth, on the upper part of the mouth, or on the upper part of the mouth. Then we talk of inferior. Inferior means away from the head, on the lower part. So the opposite of inferior means superior. So the stomach is inferior to the lungs. Okay, meaning the stomach is found on the lower part of the lungs. The lower part of the lungs. You can find the stomach. Then we have the cranial. Cranial means towards the head. Okay, towards the head. Cranial also means superior, but now the opposite cranial is caudal. The brain is cranial to the spinal cord. Okay. Then we talk of caudal. Caudal means towards the tail, the lower part of the body. Okay, so the opposite of caudal is cranial. The coccyx is caudal to the lumbar spine, as an example. So, thank you so much. In case you have any question, you can comment on the comment section. In our next topic, we look at the directional terminology, but under anterior and posterior. Thank you so much. Welcome.